Take Charge Parenting with the Kids Doctor is brought to you by Children's Health.
Well, now that spring is here, more kids are outside riding their bikes or playing sports, but also increasing the likelihood of injuries. In fact, 50% of children will break a bone during childhood. So here to keep your young athlete in the game is Dr. Sue Hubbard, an award-winning pediatrician and the medical editor of KidsDoctor.com, and Dr. John Polousky, pediatric orthopedist with Children's Health Andrews Institute. Welcome, doctors. We appreciate it.
Good morning.
It. So I know you specifically, Dr. Sue, you're seeing more and more kids with sprains, strains, and fractures these days. It's so scary. Why do you think this is becoming more of the norm in sports?
Well, you know, we've seen a tenfold increase in the number of injuries from overuse in the last decade. So I think it's for several reasons, Carrie. Number one, kids are starting sports earlier, and they're starting to stay in one sport, limited. They don't have a wide range of different activities. They also are using the same muscles that are not developed yet. So again, that's a problem. Their bones and muscles are still growing. And then they're having this intense, repetitive injury or use of that muscle because they play soccer.
Right.
And we really want to see kids play soccer, basketball, kickball, and swim. So they're using different muscle groups.
That makes sense, doctor. We all know that kids, they're resilient, and especially they want to play no matter what. I know my boys, they almost fake it when they may be hurt because they want to keep playing in the game. So how do you know when they're truly hurt? What's the difference between being hurt or maybe just tired?
Right, that's always a challenge. My son's the same way. And,
right.
And really, what I do, and I think parents should do, is kind of observe them when they're on the field, and if they're not, running as fast as you do or limping, kind of when they don't know they're being watched, is kind of when you can tell, because usually you can tell when something's not right with your child, or if they complain about the same thing over and over again, and it just is one of those complaints that doesn't go away.
What's the difference, though, between a strain and a sprain? They sound a lot alike, but they're not the same.
Right, they're often confused. And a strain is really like a muscular injury, like a pulled hamstring or pulled back, we think of that. A sprain involves a joint and the ligaments around the joint, like a sprained ankle, sprained knee.
If a child is injured, though, with either one, what's the best course of treatment?
So we think of really simple terms, something called RICE, which is rest, ice, compression, elevation. That's the general first treatment, is resting it and decreasing the inflammation.
Which sports emergencies need to be seen immediately versus one, where maybe the parent could wait 24, 48 hours?
So we think of fractures as something we'd really like to see immediately, something where obviously you look at the extremity and it's crooked, very bruised,
or the bone is sticking out, as I always say, which
that's always
rare.
That's a bad one.
It's rare, but it does happen.
Yeah, that happened actually with my middle child.
Well,
that's when you know you need to go right away. So, Dr. Sue, pediatricians like you, I know you're absolutely thrilled that there's actually a sports institute in North Texas.
You know, Carrie, we are so lucky to have the Andrews Institute here and have specialists not only who are pediatric orthopedists, they also have been fellowship trained extra. I mean, they go, and so they're sports also. So we are very lucky, and it's a huge referral base for us as pediatricians.
What sets Children's Health Andrews Institute apart from all the other clinics out there, would you say?
Well, it's what Dr. Sue said. I mean, we're all trained in that age group, kind of 22 and below, specially trained in sports medicine and pediatrics, and that's a really uncommon combination of training. So we have spine doctors, we have sports medicine doctors, we treat concussions. We can really provide the full spectrum of services to children under 22.
And Dr. Sue, wouldn't you agree that because of that, parents can rest assured that they're actually seeing someone, this is their specialty?
Yes, I think we're very fortunate because we draw patients from throughout North Texas for this expertise. So I feel really lucky when they joined the faculty, and we have them right here.
Yeah, not everyone is as lucky. They don't have something right in their backyard.
We're fortunate.
Yes. Hey.
Especially this whole group has all boys.
Exactly. We know what we're talking about. Thanks, guys. We appreciate it, doctors. All right, for more information about Children's Health Andrews Institute, you can visit childrens.com, and you can also follow Children's Health and the Kids Doctor on Twitter and Facebook.
More than 100 years, 30 locations, 50 specialties, countless ways to care, one new name. We're Children's Health, and we're by your side.